Antibiotics are one of the most common treatments dispensed for a whole range of different conditions in our pet dogs and cats. But how much do you actually know about safe and appropriate use of antibiotics? Well, today I'm answering all of your questions. Hi, I'm veterinarian Dr. Alex. This is Our Pet's Health, where I want to help you understand and optimise your pet's health so that they can live the long and happy life that you want for them. And last week I put the word out wanting to know what questions you had about antibiotics in pets. And I'm going to start off with those from Ines, who is a channel member and a super dedicated cat owner. And she really went to town. Once she got on a roll, she asked a whole load of questions that were very similar to a lot of others. So let's jump in. So the first is, are there any type or brands that are better to avoid in cats or ones to recommend? We'll also jump into dogs here. So the simple answer here is no, there's not any particular antibiotic that is generically better than any other. So we don't think of antibiotics in terms of strength, with some being stronger or weaker than others. It's just they have a different spectrum of activity, and that means that they're active against different types of bacteria. Now, some antibiotics are what we call broad spectrum, which means that they actually tackle a lot of different groups of bacteria. Others are much more narrow spectrum. And actually, it's these narrow spectrum activity antibiotics that are much better to use, if at all possible, because we're much less likely to target bacteria in other parts of the body, which can potentially cause some problems, like diarrhea, which is actually one of the things we're going to come to. But also, a narrow spectrum of antibiotic is much less likely to cause superbug or multi-resistant bacteria to be created. Now, antibiotics do come with potential side effects, just like anything that we use to treat our pet, whether that's natural and holistic or whether it's pharmaceutical. Anything that actually does something is going to have the potential for side effects. Thankfully for antibiotics, the vast majority of this is a bit of an upset tummy, a little bit of diarrhea, but nothing more serious. There are certain antibiotics that do come with other side effects. So trimethoprim sulfonamides can cause dry eye in dogs, where actually the tears stop being produced. Enrofloxacin, and the most common trade name here is probably going to be Baytril, maybe depending on where you are in the world. That can cause retinal degeneration in cats. Now, this is a super rare problem, but it may be a reason to avoid that antibiotic, and it's going to be something that your vet is going to consider the risks versus the benefits for when they are prescribing any particular medication. Metronidazole is another common antibiotic, and at high doses in dogs that can cause tremors and seizures. But it's important to remember that with the vast majority of side effects in any individual, those that do occur are generally very mild, and more serious side effects, which unfortunately we can't always predict and we can't always avoid, but they are super uncommon. But this always goes back to the risk versus the benefit. How serious is the condition, and what do we need to use and do to actually treat it? Because clearly there's no point in giving a medication that's not going to work just simply because it has a much lower risk. So with this risk of diarrhea in mind, the next question was, should we automatically and routinely be giving probiotics to dogs and cats that are taking antibiotics? Now, this is an interesting one, because there's never going to be anything wrong with giving a probiotic. Not going to do any harm, and it may absolutely prevent any diarrhea from happening. And actually, we know that antibiotics, even in those dogs and cats that aren't getting diarrhea, they're not targeting just one particular area. They are going to be killing normal bacteria that are present in a healthy intestine. And that intestinal population, that microbiome of the gut, can actually take 4 weeks, sometimes even more, to return to normal once antibiotics are stopped. So yes, probiotics are going to be a benefit here, but it is important that we are using pet-specific probiotics. Human probiotics aren't going to cause any harm, but the populations in the human gut are different from those in dogs and cats, so we're not going to be getting the full benefit. And it's especially important that there's no supplements or additives. Something like xylitol, which is present in some human medications, can be absolutely deadly for our pets. But should we be giving probiotics to every dog or cat alongside a course of antibiotics? I have to say it's not something that I routinely prescribe, but if I know a pet does have a very sensitive tummy and they are prone to diarrhea, then it is something that I will give them. And it's certainly something to ask your vet about, and it's never a bad idea. And the next question is there anything that a pet parent has to look out for besides dosage, timing and duration of a course of antibiotics? Well, I think the first thing that we have to think about is actually not to assume that antibiotics are by default going to work. So with any treatment, it's really important to keep an eye on what your pet is doing. Are they recovering as you would expect? Has anything else started to happen that might mean that the treatment plan needs to be changed? The antibiotic dose needs to be increased in length. Other treatment needs to be added. More investigation, more testing needs to be done. So we need to be in close contact with your vet if there is anything out of the ordinary happening or if anything changes that isn't expected. Equally, on the flip side, if your pet seems to be getting faster than anticipated and you've still got a whole pot of antibiotics left, should you be stopping them? I would be getting in touch with your vet, because it may be with some conditions that it is appropriate to reduce the length of that antibiotic course. But equally, we know that in some situations, actually, when things have cleared up visually, all of those signs that you're visually seeing have resolved, we actually often need to keep going with antibiotics for a little bit longer to make sure that we're completely eliminating that infection in deeper tissues. So the next question is about long-acting antibiotic injections. Are they better for a cat or for a dog? Are they worse than giving an oral antibiotic? Is it really just for convenience that these long-acting injections are given? So to start with, there are not many really long-acting injections. The big one here is Convenia. Now, this is something that is mainly given to cats. The reason here is that the dose for dogs is pretty huge and is cost prohibitive. It's incredibly expensive. But equally, if that's the drug that's needed, then that's the drug that's needed. Long-acting injections or multiple short-acting injections are a really good option in a number of situations. The first is going to be if we've got a patient who for some reason can't take oral antibiotics. It may be that they're too unwell, maybe that they're vomiting profusely and they're just not going to be able to keep those antibiotics down. Injection is great here. The other clear beneficial situation in our cats especially is if they're simply impossible to medicate, because there's no point in me giving you, the pet parent, a course of antibiotics if you're not going to be able to physically get them into your cat. Now, there are clearly a number of strategies that we can use to pill or to tablet your cat to give them oral medication. There are pastes which can be easier to give. There's liquid options for a number of different antibiotics. And there are certain strategies for actually giving pills. So popping them into the back of the cat's throat so they swallow them is pretty easy for me at the vet clinic, but your cat doesn't behave at home the way they do on my consulting room table. I know that with my own cats. They can be more challenging. You can crush them up and mix them with the food. That's not appropriate for every medication, but it's something that can work very well. You can crush the tablet and mix it with a little bit of butter and smear it on your cat's leg, where they'll then groom themselves off. Cats are very fastidious cleaners, so that's often a great strategy as well. But if we're doing any of these things, it's important that you keep a close eye on your pet to make sure that they are actually taking that antibiotic as you think they are. And the next question was about transdermal antibiotics. Are there any available? So transdermal medications are those that we apply to the skin and they then get absorbed into the body as a whole and are then spread around the body. And so for an antibiotic could fight an infection at an area that's different from the surface layer of skin that is applied on. So the short answer here is no, there's not any transdermal antibiotics. Those that we use topically, so I'm thinking antibiotic eye drops, ear drops, skin ointment, they really work just in the area that they are applied. That said, there are a lot more transdermal options coming available on the market, and I suspect there will be more and more in the future, so definitely watch this space. The big transdermal medications at the moment that I can think of are those to treat hyperthyroidism, which is very common in cats. We actually can use transmucosal medication, which is where it crosses the mucous membrane. So that's the gums and the tongue. And we've got a painkiller here. There's an anti-sickness medication. And then there's also a drug called mirtazapine, which is an appetite stimulant that can be applied transdermally. This is not available everywhere. It's actually not available here in New Zealand, but it is something that is available in other parts of the world. And these are great options for those pets that are potentially pretty challenging to medicate. Now, if we're not using antibiotics responsibly, there's a good chance of superbug creation, multi-resistant infections that mean antibiotics are going to be useless in the future. You can find out more in my video linked on screen now, so click there. But until next time, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.